Hey guys, welcome to your favorite pharmacist along with Kay, my co-host. How are y'all doing today? And we
Hello, hello.
hello, we have Dr. Deb Matthew. She is a holistic doctor. Give her some hand claps. And she is having the time of her life, but she still took time to talk to us today. And I am so appreciative. So she's a holistic doctor. And can you please explain right out the gate? I'm gonna let you explain it because you go do it best. What is a holistic doctor?
Well, so I went to medical school just like all your other family doctor, gynecologist, all your other doctors.
Mhm.
But in my own life, I wasn't feeling that great. And I learned that I was having hormone issues, vitamin deficiencies, things that were going wrong that weren't making me feel that great. And once I realized that, I learned there was a whole bunch of stuff they didn't teach me in medical school, because really what they teach us in medical school is how to write prescriptions. So if
Right.
your cholesterol's up, we got a pill for that. If you got a headache, we got a pill for that. If you're constipated, we got a pill for that. But what we don't always do the best job at is trying to understand the why behind it. Why do you have these headaches, or, aren't you sleeping, or whatever the case may be? And so a holistic doctor tries to understand why you're not feeling that great, tries to correct the underlying problem so that you feel better. You don't need the pills.
Wow. Okay. So yeah, you did that much better than I would have ever thought to do it. So basically, you are not basically you are a medical doctor. So what was the shift where? Okay, so you're right. Everything is the magic bullet. Like you have this problem. Okay, boom. This is gonna be the immediate solution. If you have that problem, boom. Immediate. Magic bullet. But what was the shift in your life where you're like, you know what? This writing prescriptions doesn't make any sense. Like, what was that shift to, get you from a medical doctor that does the typical to doing a holistic doctor?
Yeah, because it's a big change, isn't it? But
Mhm.
so for me, I used to be tired all the time. I
Right.
was so exhausted. My favorite hobby was napping.
Mhm.
And I was always freezing cold. Like even
Sound
in
like somebody else
July
I
in
know.
North Carolina, I was taking a sweater with me because, the air conditioning in the restaurants, I would just freeze.
Right.
And I got really irritable. I was just shrieking at my kids over every little thing. And then I felt like the worst mom ever, because that's not how I wanted to be.
Okay.
And my poor husband had to put up with me. He didn't know what the heck to do with me. But what changed was I read a book by Suzanne Summers, right? The celebrity.
Right.
And I didn't want to read the book because, medical doctors, we don't want to get our information from celebrities. That's
Right.
not right. That's not right. But I knew that something was wrong. I knew that I didn't feel normal, and that nothing in my medical training helped me understand what the heck was happening to me. And so I read the book, and I read all these stories of these women and how they were feeling. They were just like me, all messed up.
Right.
And then they got their hormones back in balance, and they felt back to normal again. And reading that book allowed me to open my mind and realize there's a different way of doing things. And it also allowed me to find that there were places that I could go as a medical doctor to get trained in how to actually make people well, and not just put band-aids over their symptoms with these medicines. And the reason I learned that I wasn't feeling well is I was hypothyroid. I knew that I was hypothyroid. I was already on the thyroid medicine. I've been on it for 10 years at this point. But
Okay.
that thyroid medicine wasn't making me feel better. It was making my labs look normal, but it wasn't making me feel normal.
Now that's
And that's how
interesting.
we're trained, is if you've got low thyroid, first of all, it has to be outside of the normal range or we don't bother with you. But
Mm.
if you've got a thyroid problem, we give you a little pill until your thyroid test is normal, and then we feel like we're done. But if you're still tired or struggling with your weight or don't feel good, then you must be like depressed or lazy.
Right.
And so what I learned is there are lots of other things that we can do for your thyroid. And I got myself feeling better again. I got my life back. My kids got their mom back. My husband got his wife back. But
Okay.
after that, I couldn't just go back to writing those prescriptions all day long because it just didn't feel right anymore. It didn't make sense to me.
So that is okay. So this is the first time I've heard this where you were had hypothyroidism. I can't say the word, but y'all know what I'm saying. Low thyroid hormones. And you took the typical thyroid medication that was prescribed to you. And your lab values were normal, but you still didn't feel any better?
I couldn't tell any difference. And, I used to forget to take that pill, like sometimes for a week at a time. And
Right.
it's not because I was trying to be a terrible patient, but I just forgot. I couldn't tell any difference whatsoever. And it's just because it wasn't working for me. And it's a really common problem. A lot of women suffer the way I do. So part of why I want to come on shows like this when I'm invited is because I want people to know that if you don't feel good, but your doctor says that everything is normal,
Mm-hmm.
there's something wrong. And I don't want anybody else to have to suffer for 10 years. I was on that medicine for 10 years before I learned that there was another way and before I could get back to feeling normal again. I don't want anybody else to have to suffer for 10 years before figuring it out.
Wow.
What did you change?
So a whole bunch of things. One of the things that I changed is I changed the type of thyroid medicine that I was taking to a more natural kind. That was one thing. And then also I treated my adrenal gland. So when we're stressed, it affects cortisol, which is our main stress hormone. And when our cortisol level goes up, it shuts down how our body uses thyroid. So at this point, I just finished all my medical training. I had 4 little babies at home. I was all stressed out.
Right.
And the stress was part of why that thyroid pill wasn't working for me. So those 2 things were really important. And then the third thing that was going on at the same time is I was in my late 30s. And because I was in my late 30s, my hormones were starting to shift. Like when you're in your 30s, you're not thinking about menopause, right? Menopause is something that happens to people way down in the future. But my hormones were starting to shift. And progesterone is the first female hormone that starts to slide downhill as we're heading towards menopause. And progesterone is the calming hormone. It's the one that helps you sleep soundly and everything is okay. And you just calmly deal with your children when they've just trekked mud all over your carpet instead of losing your mind and screaming at them, which is what I was
shrieking.
And so once I got my progesterone balanced out, then it made me feel calm. I felt less stressed. My cortisol got better. Got my thyroid, the treatment working better. And I was back to a completely new person.
So Vega asked, was it Hashimoto's?
I do have Hashimoto's, yes.
Wow. Okay, Vega, making diagnosis. Okay,
That's
go ahead,
right.
girl. So what is
Hashimoto's, for people who don't know, because it sounds like some kind of itchy rash or something, doesn't it? But Hashimoto's is an autoimmune condition. So it's where your own antibodies, your own immune system start attacking your thyroid gland, where they're supposed to be attacking germs, but they attack your thyroid gland and damage it. And so now you don't have enough thyroid hormone anymore.
Oh, wow. So that's why that typical thyroid medication wasn't doing anything.
So Hashimoto's is the most common reason for women to have hypothyroidism. Probably 90% of women who are hypothyroid have Hashimoto's, but almost nobody knows that.
Wow. Okay. So a lot of times they don't actually get the right diagnosis at first, you're saying? They just get the typical hypothyroidism, but they don't get
That's
that.
Right.
Wow.
That's right.
Why not? Why not? Why?
Well, in
just kind of not doing properly.
Yeah, in medical school, we are trained that if your thyroid test is out of the range, then we give you that Synthroid, the standard pill, until your test is normal. Like easy peasy, right? Our job is done.
Right.
But if you have Hashimoto's, the problem is that it's an immune system problem. It's not really a thyroid problem. In other words, your thyroid would have been fine if your immune system just left it the heck alone. But what we want to be doing is we want to be addressing your immune system function to try to save your thyroid, to try to calm your immune system down. But in conventional, medical training, all of that sort of feels irrelevant. All we really care about is thyroid is low, give you the pill.
Right. And I love that because I know, of course, like you said, you've been trained to just, problem, magic bullet. And that's how we were. Of course, our training is nothing compared to y'all. But, we were trained to, okay, they come to us about an over-the-counter problem, boom. And if you're really good, you kind of dig deeper. I had a couple of occasions where patients were on like 2 or 3 heart blood pressure medications. And the doctors, they were about to give like a fourth one. And sometimes this one lady, she was in her 70s. It was insane. So she was on the third one. And I was like, well, what's really going on? Like, did you have anything that went wrong, recently? And so she said, no. Okay. So her daughter was like, well, mom, dad just died back in, I will never get, it was in March. I can't remember the month. It was still within a year. And so her blood pressure was spiking because she was having underlying stress and depression from losing her life partner. And so instead of just taking the time to get to the root of why are we giving, because you could tell she was a compliant patient. You could, a lot of times you just can tell. So if the patient is compliant, let's get to the root of it, not just add on a third drug to an elderly person. So that's when I really was like, okay, medicine is not everything. It's like, what is that underlying problem? Attack that and then build up. And if you could do it naturally, that's what you want to do. But after that point, if you need the medicine, fine. But if you can do it naturally, holistically, that's the way to go, because that's what our body will naturally respond to anyway.
Right.
So,
and it's just in medicine, we've gone too far in the direction of prescribing drugs, right? Like sometimes we got to have the prescription medicine. Sometimes they're real important, but a lot of the conditions that people really struggle with these days, they tend to be chronic things, right? Things like heart disease and diabetes and arthritis. And these are all things that we don't have a cure for. And these medicines that we're giving, they don't really do a great job at making people well. So like if you've got arthritis and your knee is in pain, okay, fine. You got to take some anti-inflammatory pain medicine. But if we could help you be anti-inflammatory in a lot of other ways, maybe you wouldn't need so much pain medicine. And then maybe you wouldn't need to take like the other pill for the side effects of the first pill.
Right. And that's you hit it right on the head once again. A lot of times you can get one medication to treat one disease state, and then you have to get another medication to treat the side effects from the first medication you're taking for the disease state.
That's just insane.
It is. And it was what it's called. Big pharma, money, but I'm still in the game, so I gotta be easy. When I'm like you, Dr. Matthew, then we can talk about big pharma and all that. But I'm still in the game, so that's my bread and butter.
Can I comment on this food triggers here? Okay, so I love that because let's just say somebody like this is a common person that would come and see me in my office is like they're healthy in the sense that they don't maybe have been diagnosed with like a million diseases, but they're often struggling with their weight. They just feel kind of tired. Maybe they're kind of irritable. They don't sleep that good. They feel kind of bloated, kind of achy, like just all these kind of things, right? Like they're kind of depressed, they're kind of irritable. And so often what we find is that food is a really big factor in how they're feeling. So when somebody comes into my office, we do a whole bunch of lab work. We look at their vitamin levels and their hormone levels and the kinds of bacteria, the probiotics in their gut. So we do all this testing. But while we're waiting for the results, we talk to them about what food they're eating. And often, when they come back for their follow-up appointment to get their test results, they already feel so much better because we've dealt with food. And so some of the really common things are sugar, because sugar is a toxin. It's inflammatory. You can get more mood problems and you feel just more kind of unmotivated and you don't sleep good. So your weight, all that. So definitely sugar is a problem for a lot of people. And then another one is gluten. So gluten is the protein in wheat. And so especially for people who have Hashimoto's like me and 90% of the other women who have hypothyroidism, a lot of us have a hidden sensitivity to gluten, which is a protein in wheat. So if we're eating bread and pasta and muffins and all the normal stuff that everybody else eats, it just causes more inflammation and makes us sick. But it's not obvious. It's not like a shrimp allergy. You eat the shrimp, your lips puff up, you get the hives, you can figure it out. But food is so important for how we feel.
Right. It could be the medicine, quote unquote, so to speak. Like I just had like a bowl of chili and I'm feeling fired up inside. And it's not a warm and fuzzy fired up. I can feel inflammation in my body and I can feel I'm bloating up now. So I can tell that I shouldn't have ate that preservative filled chili that they probably dumped out the bag and put it in a microwave. Yeah,
they literally dump it out of the bag.
Literally, right.
Literally.
But a lot of time, even though my mouth is happy, But right now, because my belly is a little irritated, it's kind of weird because our immunity is in our gut. And so now it's kind of, it's a connection to my gut and my
There
hair.
is a connection, absolutely, between your gut and your brain. And that's so important. So let's just say somebody has anxiety or depression, right? So with the pandemic, like everybody, right? We're all like anxious and depressed and unmotivated and tired and et cetera. But the chemicals in our brain that affect that, right? Like serotonin and dopamine, these are the chemicals in our brain that make us feel calm or anxious or happy or sad or depressed or whatever. And so many of them are made by the bacteria that live in our gut. And so if you've got a problem in your gut, whether you got bloating or you got irritable bowel syndrome or constipation or you get loose stools or whatever the problem is, that's not just affecting your tummy. That
Right.
affects your brain, your mood, your memory, your sleep, your energy, your focus. It's
Like
so
shaking
important
all
for
the
people to
time.
realize. Yeah.
Oh, go ahead. What were you saying? Oh, you were
It's so
done.
important for people to realize the impact that food has on our whole system and using food as medicine, right? We all know how we can eat junk food and feel bad, but you
Right.
can do the opposite and eat healthy food and feel good. And that's a
Okay.
wonderful thing to do.
Now, I love that you say that. Okay, you can eat junk food, you can feel bad, but also flip, you can eat some good spinach, some good kale or something. And it's like I always hated Popeye. I hated that cartoon, but it had like a good underlying message. If like now if I eat some spinach or some kale or any kind of greenery, like I am hyped up. I feel so much better to the point I bought like this kale spinach powder and I put it in a powder a capsule rather, and I take it. So it can really help. Let me see, Vegas, I had an herbal blend that blocks the antibodies, and I feel like the weight off of me, like the weight is off of me. Wow.
That's great.
Mm-hmm. My daughter, okay, so before I read this one, you said 90% of women, if they have hypothyroidism, is more likely going to be the Hashimoto's.
That is the most common by far cause of having low thyroid function.
So all of these women that have it, they probably don't even know. That is so that gives me more information to work with. So whenever I talk to them about their medication, when I counsel them, I can tell them go deeper.
Yeah.
And because they, like you said, they never really feel better. They come in sluggish, getting the medication, like like a bunch of drones or so. That's like
Zombies.
zombies, yeah, zombies. You see, my daughter was diagnosed with hyperthyroidism before she became a teenager. We tried a radio ablation, but it didn't shrink it, so they took it out.
Yeah.
So
So that's a different cause for low thyroid, right? She had to have her thyroid removed. But so now that's maybe an important thing to say here is, so she's had her thyroid removed. So all she's got to rely on now is the pills that she's taking, right? And the pills that we give out, the standard stuff, Synthroid, levothyroxine, all the different versions, it's called T4. That's the kind of thyroid hormone in it. But what our bodies actually need it's something called T3. So you swallow the pill, it goes in your system, it doesn't actually do anything. And when it gets into your tissues, you have to convert it into T3. And if you're not so good at converting it into T3, then that pill's not really going to work for you. And the things that interfere with being able to convert it into the T3 that your cells really need is stress, inflammation, if you're deficient in certain vitamins, if you don't have the right bacteria in your gut. So those things are real common problems for a lot of us. And that's why we take the pill and it doesn't really work for us.
Okay, so with your practice, let's say I'm your patient and I'm like right now I'm burning up. Like my chest down to my whole belly is burning up from that really good chili I just ate that's making me depressed. So, and I do have issues where certain foods I'm more sensitive to my body and I can feel the inflammation. I don't see it as heartburn because it's really not heartburn, it's inflammation from food. So how do you work up a patient? Like how does that work?
Yeah. So if somebody comes in, I start off by looking at the whole person. So let's say their main complaint when they come in is that their belly is bothering them, or whatever it is. We still want to look at the whole person. And we're always thinking about 4 pillars of health. So we're thinking about hormone balances, we're thinking about toxins in the environment, we're thinking about gut health, and we're thinking about lifestyle habits. And we start off by doing a lab evaluation because we want to understand, what's your hormone balance? Do you have too many toxins in your system that are messing things up for you? Are you missing certain important vitamins and minerals? Do you have the right gut bugs in your gut, the right probiotic good bacteria, or do you have too much of the wrong stuff? So we do a comprehensive lab evaluation to really understand how your body is working. And then based on what we find, we do a customized wellness plan in order to correct the problems that are keeping you from being well. So really what we're trying to do is we're trying to understand the root causes for why you're not feeling as good as you should. And then we correct those so that you can get well, so that you can get off as many prescription drugs as possible and love the way you feel.
Okay. So dairy, wheat, sugarcane, deep fried stuff. So that's like a lot of high inflammatory foods. And I love what
Those
you
are
just
very
said.
inflammatory foods.
I love what you just said, because doctors, the typical medical doctor, they treat everyone the same way. So why they don't dig in deeper? Because a lot of times if you just ask one extra question, then you can get that proper answer. I know, like,
Insurance.
are you serious? So yeah, why doctors don't really just go deeper? Is it like a money thing, or it is a time frame thing, or what's they don't get care thing, or what's the problem? They feeling great.
There's a bunch of problems. So one problem is the insurance thing. So insurance companies will reimburse for one thing. So I have a patient who, this is a terrible story. He came in and he had his like annual checkup, right? So he goes in for his annual checkup, and while he's there, he also says, like, my elbow's been bothering me, and what can I do about that? Or what do you think could be wrong with my elbow? And the doctor kind of briefly looked at his elbow, didn't pay too much attention to it, and told him it was fine. So he got billed a $500 charge for checking his elbow because he got, the annual visit that got paid by his insurance, but then also he got billed for like an extra visit for checking out his elbow. And he called his insurance company and said, that's not fair. Like, the guy barely even looked at my elbow. I mentioned it as I was walking out the door, but it stood firm, and he had to pay $500 because he asked one extra question about his elbow. So one challenge is how insurance works, how doctors get reimbursed. Another challenge is definitely time, because most doctors have to see patients like one after another, because of the hospital system that they work for, the way that our medical system is set up. And all doctors would love to have more time to spend with their patients and really sit down and get to know you and check in with things. But that's just not how our medical system really works. So, and then the third thing is, it's just not how we're taught. We're taught to make fairly quick decisions. If your blood pressure's up, the first place our brain goes is, which is the best blood pressure pill for you? Or if your cholesterol is up, right, which is the best pill? We're not sort of stopping to say, like, why is your cholesterol up? Because, hypothyroidism is a cause of high cholesterol. But I 100% guarantee if you go to your doctor and your doctor measures your cholesterol and your cholesterol comes back high, that doctor is not going to say, gee, we should check your thyroid. Never going to happen.
Seems like that should be like, it seems like they should do a whole panel though, right? So they would just check for cholesterol and not check for the thyroid?
They go for the obvious answer.
Oh, wow. That is so slack.
But that the high cholesterol is not a lipid deficiency, right? There's a reason for it.
Right. Oh, you said cholesterol is what again now? Hello.
If you have high cholesterol, it's not a Lipitor deficiency, right? Oh, am I frozen?
Yeah, you were frozen for a moment. Yeah. You said cholesterol is not what kind of lipid deficiency?
It's not a Lipitor deficiency, right? It's not a medication deficiency. It's not.
Right. Exactly. Wow. Let me see what else questions they have.
I know there was a doctor I went to see for an accident I'd had, and she was telling me, because I fell in love with her because she was so thorough during my visit. And I did notice that the entire time I was talking to her, she was just listening, and she was writing notes, but she wasn't going into the computer. that's in the room, right? And so while I'm sitting there talking to her, I'm like, I think I'm going to stick with this practice because I was ready to leave because I didn't like my other general practitioner there. And she was like, oh, this is my last week here. So I'm like, no, why? And she said, because she was sick of the system there, basically saying she was leaving a practice to go work for the health department. And I was like, who does that? And she said, because, they time you. The moment you turn that computer on in the room, you're timed as to how long you can spend with your patient. And so that's why she waited until after she had collected all of the information from me and actually had an in-depth conversation with me to figure out where I actually needed to go. She didn't want to touch the computer until we were at the end of the visit, so she wouldn't be timed, and it counts against her if she's in that system. She had like 3 minutes to be in the room with me once she turns that computer on.
That's ridiculous. That's ridiculous. I mean, working at a pharmacy, it's like a bunch of bombs blowing off all the time there. Like, wore out from all these pediatric vaccines. And they have us on a metric system, but they're just now learning that it's all about patient care. It's like, how did we just veer off from the people that we're serving, which is the patient care aspect of it? Gail Lockett said, she said her daughter's on Synthro and she has been fine all these years. She recently started having problems with her weight and she's tired of it. So, at this point, she needs to see a holistic doctor, and you can do holistic care online, correct? Or you have to see that. Well, no, they have to do like a test or something, correct?
There are lots of doctors now that are doing more holistic care online. Some things can be done, like tests can be done, you can just go to your lab and get the test done. You don't necessarily have to be in the doctor's office.
Sure.
But there are rules about practicing medicine across state lines. So there are some limitations.
Okay, gotcha. So Gail, maybe look into a holistic doctor, definitely, because there's something underlining that the medication is not going to do by itself. Let's see. I didn't know what I know now. I just went with whatever the doctor said. Yeah, these days we have, I hate to say, because they don't mind coming in the pharmacy and say, well, I Googled it. But we do have some foundation to build upon. And then whenever you pick your healthcare practitioner or, whoever that you trust, medical wise, then you can build and vet your information from there. Is it true doctors are independent contractors?
Most doctors aren't. Most doctors are employees of either a hospital system or something these days. So, and that's changed. Used to be that doctors owned their own practices and, they could see as many patients as they want or not. But now almost all doctors are employees of the hospital systems, which is a problem. So now they got to do what the insurance tells them to do, and they can do what the hospital system tells them to do. And so doctors want to help their patients, right? Doctors don't want to just write prescriptions all day long, but they're kind of trapped in this system, which is really tough for everybody, tough for the doctor. Doctors are burned out and exhausted. Yeah. This pandemic has been hard for doctors too. But medicine's become a business.
Have you seen a spike with patients during this time with everyone with COVID, and they want to find different ways of treating the vid? And, so do you see people are migrating towards natural medicine after they don't have the trust in now government is into the medicine and et cetera, et cetera? You know what I'm asking?
Yeah. So I can tell you that we've been really busy. I think that people more than ever want to be healthy, right? Like we've identified that the high blood pressure, diabetes, like all these health conditions just put you at greater risk of getting real sick. And the pandemic is a big deal there, but even other, health related things. So I do feel like people are wanting to know what they can do to be healthier.
Okay. And Gail Lockett said, my daughter has been a vegetarian for over 5 years now. They changed her dosage last week. So hopefully that helps. But a lot of times, hopefully that helps. But to be honest with you, and the more, I kind of, been in the same field for so long, and I'm not jaded per se, but I see things for what they are, and I see how much money means to everything in life. So with that being said, I would definitely find other ways of holistic medicine, to be honest with you, because that's more likely that will help your daughter. But that's for information purposes only. Greetings, Ron. Thank you for coming. Right, we needed Dr. Deb and her comrades for your daughter. As we learn better, we can do better. Oh, that's sweet. That's what blind guy, his wife, their life said. Let's see here. Okay, that's it. All right, so now that we got the holistic part out the way, let's get, since we're older women in our 40s, and there is a way of holistically getting through the menopause, getting through, the thing that comes from menopause, and it's called, I learned it from Jada Pickett Smith, Will Smith's wife, about vaginal rejuvenation. So what is that? Because I'll never forget, she said she did it some years ago, and she said she was so glad because now she has her perfect little peach back, whatever that meant. But what is that? Because can it help with the menopause part, or what is that?
Yes. So back in the day, we didn't really have anything to offer women other than hormone therapy if like dryness or drooping, or our bodies change as we get older, right? Our skin
Right.
gets thinner and droopier, and things just change. And sensation changes, and we get more at risk for things like urinary leakage or urinary tract infections. So now we have a whole series of treatments that we can do in order to restore things. So just like for your face, right? We got skin creams for your face, and there's Botox and laser treatments. There's all kinds of things that we can do to keep your skin looking young. Okay. So there's all kinds of things that we can do to keep your intimate parts looking and behaving young as well. So one of the things that can be done is laser treatments. So there are different companies, like different brands, but there are laser treatments that work really nicely to tone and tighten both the inside of the vaginal lining and also the parts outside, just to make things look more youthful again.
Okay.
Helps a lot with vaginal lubrication. So, for comfort, because sometimes as we get older, this is something people don't really talk about, but especially after women go through menopause, like maybe not so much in your 40s just yet, but after you're 50, you go through menopause, it can become painful. And so this can really help a lot with the lubrication. It helps improve sensation. And it also helps to reduce urinary leakage. So, if you cough or sneeze, sometimes we leak a little bit. And so this can really make a big difference. It is not uncomfortable. It's non-surgical, takes, maybe 45 minutes for a treatment. Usually you come for a few treatments, about a month apart. But it really makes a big difference. So these vaginal laser treatments, really can be a game changer for a lot of women.
Okay, so I got questions.
Okay.
Okay, so after you said it's about a 45-minute session, and after approximately 4 sessions, you're good to go.
Yeah,
do you need a tune-up?
Usually we do 3 sessions, and
okay.
then after that, you're good for a good while. But
what's
the
a good
aging
while?
process, well, I don't know, a year. Like the aging process is going to pick back up, right? Okay. So we're going to turn back the clock, but then the clock is going to start kicking again. In which case, you come back in for like another treatment. Once a year, often as you like, but it doesn't last forever. But it's not like it just wears off and you have to keep coming back over and over again.
How long after the session can you have sex?
So depends on what we do, but typically 48 hours.
Oh, dang, gotta wait, huh? Okay.
2 days, okay, 2 days.
Oh, you want to try out that new cat like immediately.
Well, and I'll tell you another thing that we can do. There's a completely different treatment, but another thing, and it's called an O shot. And this is where we draw your blood, like as though you're getting a blood test done. And we separate out the growth factors from your own blood. And then those growth factors get injected back into
the G-spot?
Yes. And so it sounds painful, right? But it's really not. We use some numbing cream. It's not bad. So we do a couple of injections. One is right into the clitoris and one is into like the roof of the vagina, basically where the O shot is. And your own growth factors from your own body get to work to rejuvenate things. So they activate the stem cells that already live in your body. Those are the cells that rejuvenate things. And you grow new blood vessels and nerve endings and collagen fibers. So in a very different way from the laser, it also improves sensitivity, improves lubrication, sort of tones and tightens. And that one, there's no downtime. You can go home and get it on if you like. But it's something that really works great too. So great for women who are having sort of like just want to have improved sexual function, improved orgasms, less time to orgasm. I mean, it works great.
Greedy.
And works great if you're having any kind of incontinence, urinary leakage.
Yeah, okay. So this doesn't have to necessarily be for women that's approaching menopause or in menopause. This can be for a woman who just had a brand new baby in their 20s and they have like sneezy pee-pee problems.
Yes.
Okay.
And it can be a game changer because, here's the thing. If you are in your 20s or your 30s, maybe you had a big baby or, some kind of certain, birth complications, whatever. And so now things might not feel the same. You might be leaking urine. It's only getting worse with age, right? Oh, if you maybe it's like a small problem right now.
Right.
But it can be a big problem in the future. So if you wait 20 more years and now you show up at the doctor and you got a big problem, the only treatment they really have is to do surgery to try to help you from, peeing your pants all the time. Wow. But they don't really have anything to help improve the sensitivity. And so, these things make a really big difference.
So what's the difference with the O shot versus the typical laser vaginal rejuvenation of it? So does the O shot, does it make it pretty again?
So the O shot, the O shot isn't going to change how things look from the outside.
Okay.
It's the laser treatment that does, because the laser treatment, we treat both the inside and we treat the outside. So like, for example, sometimes women get sort of large labia. And then, if you wanted to wear yoga pants or something, they're not so comfortable or don't like the way they look or, but that's where it kind of tightens things back up again.
Oh, wow.
Okay. So we're trying to avoid the camel toe / moose knuckles.
So that it can help with that. Yes.
What did you call it? Moose?
Okay.
You said
moose knuckles. Camel toe or moose knuckles. They're really big. It looks more like moose knuckles than camel toes. Or guys that wear those pants or wear their pants too snug, we call those moose knuckles too.
Gotcha. I never heard of that. So tell me about men. So can y'all is there because
we leaving the vaginal rejuvenation already? I think there's some more questions out there.
I'm being greedy because I already did all my research. I'm sorry, my bad. I'm being selfish. All right, go ahead, Kay. Yeah, and if you have any questions in the chat, please.
What's the cost effectiveness of this? What does the cost look like?
Okay, so to have an O shot, the treatment, so because we have to draw your blood, we have to treat it. So, it's a bit of an investment. So to have an O shot, depending on what practice you go to, there's different practices that do it. It typically will run somewhere around about $1,000 to $1,500 for a treatment. Usually you just need a one-time thing. And then of course the aging process picks up and maybe you'll go back and have it done again, 2 years later or something like that. But basically it's a one-time expense.
Hold on, I'm gonna pause you for a second. Okay, so for the O shot, you're looking at let's round it up to $1,500 one time. Let's say approximately every 2 years, you have more intense orgasms and a tighter vajayjay, right?
Yes.
Okay, continue.
I guess someone will be making a trip to Charlotte soon.
Then
are you based out of Charlotte?
I'm in Charlotte, yes.
Oh, fabulous. Okay, go ahead. I'm listening.
Yes. And then the other.
That's not bad. That's not bad at all. And you can last like a year or two. The only thing is it won't tighten and make it look pretty, but who cares?
It tightens. It helps tighten a little bit on the inside, but just doesn't really do much for the outside.
Right, right.
But then the other one, the laser treatment, is going to do the same things, but it's going to tighten, tone and tighten on and change the inside and the outside appearance. And, sometimes we actually, if you want to, we let women with their own cell phone, like they can take a picture, or we'll take the picture for you if you want. You can do like a before picture, and then immediately after the treatment, before you even got dressed and walked out the door, we can take the after picture, and you can see a difference on the outside.
Wow, it's immediate a lot of times.
Yeah. And then so for both of these treatments, there's an immediate effect, but then it's going to continue to be percolating and working and getting better over the next couple of months. But for the laser treatment, usually what we do is we get you to come in for 3 treatments. You notice the biggest difference after the first treatment, but then if we do the couple more treatments, then we can make it more longer lasting for you. And that one is more because you end up coming for more treatments. So usually that runs more around about 3,000. There's always specials going on and things like that. But then the same thing, you come back every, couple years or whatever. And really what works really the best is if we combine the treatments, like you do the laser treatment and an O shot. And we don't do them on the same day, but coming in.
Right. Man, that's for those only fan girls. I'm just joking.
So listen, if you got the best we got to offer, there you go.
When you say the laser treatment helps with the outside, with the labia, it shrinks the labia?
It's toning and tightening the labia. So as we age, right? As we age, our skin gets looser, right? Our boobs get droopier, and we get the, this here. And so the same thing's happening in our intimate parts. And so it kind of tones and tightens things up. So kind of shrinks things back in, and makes things look a little bit more youthful again.
Okay. What about discoloration?
Probably not going to do a lot for discoloration. So I can't promise that it's going to change that part of it. Yeah.
I like what Gail Lockett said. She said it pays for itself.
That part.
It's okay. You were concerned because you were saying, you and your hubby, y'all were together for years, like almost 30 years. So you like the way things are. I mean, but wouldn't it be an enhancement though? I mean, it can't mess things up. It can only be a pro thing.
Oh shoot.
Yeah.
Sorry. Hold on.
What's wrong?
Oh,
I'm so sorry.
somebody tried to call me.
Oh no, I hate when that happens.
Can y'all see me?
Yeah, we can see you. That's fine.
Okay.
Gotcha.
Okay. Anyway, as far as we typically do a whole lot of things to enhance it, but as far as the rejuvenation, the laser portion, we talked about this earlier today because I just wanted to get his feedback on it. He was like, "No, don't change anything." So I was like, okay, but when the O spot, I'm like, that would be really greedy of me because I'm already, as Tish knows, I am multi-orgasmic as it is. So if I was to add any enhancement to that, I might die. Literally, I could die. But it does sound really intriguing. I'm almost willing to take the chance. I would be your biggest commercial ever. Like, if I did it, it would go crazy. So
yeah, she really would. She is a walking.
Something worth thinking about. I would want to.
You say you would now?
So yeah, what's that?
Oh, I thought you said something. What did you say? You were breaking up.
What'd you think I said?
Probably that you're interested. Long story short, right?
I was saying that we could film it and everything, do the whole process on a live. If they would let me if they would let someone in the room with a camera. Now back to the O spot though. How long is that process? I know from the time you take blood, break it down, and put back in what you want.
About 30 minutes. Yeah, it takes the longest time is to get the blood prepared, and then the actual injection just takes a couple minutes. And it's the teeniest little puny needle you ever saw. We numb up with some numbing cream first, so It's really no big deal.
Yeah, I'm okay with a little pain though. I'm good.
Why did Gail? She's like, I did not need my vacation for this. Gail Lockett said, if she dies, she dies.
If she dies, she dies.
That's dies happy, right?
There you go.
The Vegas said, do it. Let's do the record.
She dies. It's a Rocky IV reference.
Hey, I know my movie. Hey, Patrice Garner. If you have any questions, Dr. Matthew is a holistic doctor. We already talked about thyroid care. We talk about how food is inflammatory, and now we progress into the vaginal rejuvenation.
Can we talk about the guys?
Oh yes, yeah. Let's talk about the guys.
Yes, absolutely. Yeah, sure, fine. Let's talk about the men.
Yeah, because they
talk about the guys. Because here's the thing: we're really talking about it for the girls, right? We could talk about the guys, but we're talking about for us too. So here's the thing: as men age, sometimes our erections are not as strong, right? It just that's part of life. And guys, first of all, they don't like going to the doctor at the best of times, right? And certainly no man wants to go into the doctor to complain about having problems with erections, right? Like that's vulnerable and, so sometimes significant others who are supportive can kind of help them to be brave enough to kind of take the step to get some help. So if a guy's having a problem, and it doesn't have to be like a full-blown problem, but just not what it was. Of course, there's the pills, right? So we can write a prescription, we can give them, the Viagra, Cialis, whatever. Okay, fine, that works. At least it works for some people. Sometimes they can have side effects. They can get headaches. They don't feel good. You got to remember to take the pill. Certain ones, you got to take them on an empty stomach. You got to plan ahead. Like it's not the greatest. There's some guys that feel really uncomfortable. Like they don't want their partner to know that they're taking the pills. It's, it's not the greatest thing. So we have things that we can do to get men naturally restored so that they can have stronger, longer lasting erections naturally without having to take a pill. Wow. And most men have no idea that this exists. And sometimes even if they know that it exists, it takes a little support to get them to like step forward and, be willing to seek out help for it.
Right.
But what we do is the treatment is called Gaines Wave. And it uses
Gaines
Wave. Yeah. Okay. Gaines Wave. And it uses sound wave therapy. So these sound waves go into the skin and cause kind of like little micro damage, if you will. And then as the body is healing from this micro damage, grows new blood vessels. And new blood vessels means more blood flowing in, and that means stronger erections. It also means the erections last longer, because sometimes what happens to guys is they can get started with a strong erection, but then it doesn't last, and it kind of fizzles out before they're done.
Right.
So, so this can allow stronger erections, back to how it used to be. And it's something that they come in the office for a series of treatments once or twice a week over, usually 6 or 12 treatments. Makes a huge difference. And the guys that like it the best are typically the ones where they're just starting to notice a problem. Like if you've had a big problem, you haven't had an erection for 3 years, like there's a lot of work to be done, right?
Right.
It's just not what it was. It's, we can really make a big difference. So
without medication.
And so for the guys that need the medication, we can often make it so that they don't need the medication anymore, which is nice.
Wow.
It makes them feel better about themselves, right? Like that this is a big deal for guys. So so that's one thing. It's called Gaines Wave.
Okay.
The other thing that we can do for guys. Oh, questions. Go ahead.
Oh, I was going to ask, is there a way to do those sound waves at home? Like, can we pay for something, have it set up at the house, trick him? He doesn't even know what's going on. No, that's what I said.
No, she can't do it for you.
I don't have a tricky way. It's actually a pretty loud treatment. It'd be hard to sneak that in.
Gotcha. Okay, continue.
But men are so goofy. You'd be like, "Oh, honey, is this something we're doing?" They would not.
Something's wrong with the TV. Don't worry about it.
Yeah. So the other thing that we got for guys is called a P shot. So we got the O shot for the ladies, and then we got the P shot for the guys. Okay. And the same thing, we draw blood, we separate the growth factors, we do a little injection. And again, we use numbing cream at the tiniest little needle ever. The guys are often pretty scared about this whole idea, just that word shot coming at them in their private parts. So we sometimes have to kind of talk them down a little bit to calm them to, but it really is, it's not so, like once they've had it done, they think, oh, that was nothing.
Where does the shot go?
right into the penis.
Ooh, right in the whole.
Right
I mean, like in
into
a
the side of
vein?
the penis. Not into the vein, just into the side of the penis.
Oh, okay, not where the pee-pee hole is.
No, no. Mm-mm.
Okay. Aubrey said he found Hennessy usually does the trick.
Yeah. See, the problem with the Hennessy is it might put you in the mood, but too much of the Hennessy kind of shuts it down. So
You ain't never lied. That is
Yeah.
true.
Yes,
Sorry.
it better be just one shot.
yeah, too much stress and too much alcohol are two things that really kind of
Right. You say put the name of the treatment in the chat, please. Which
Can I write it? I can. If I type it in, will it go?
I'm doing it in a private chat, and I can copy and paste it. So I've noticed a lot now. Men are speaking up more. Like a lot of young men, I am so surprised, who have like that underlying cholesterol issues, the underlying high blood pressure. They're young and they're getting Viagra, and I'm very, very shocked. Like I guess before they kind of just try to ignore it or work it out, but now they're coming in and getting those prescriptions.
Yeah.
And a lot of, I'm noticing too, with the older men, they are getting the topical testosterone. They're getting the shots. They're getting the gels. So do y'all have like products like that may help before you go to the procedural part of it? Or like, how would you holistically deal with a man that's y'all find out he has low testosterone?
Yeah.
Do y'all do that?
So if a guy has low testosterone, especially when he's young, like he's in his 30s, he's in his 40s, that's not age, right? Like if you're 80, we'll say, fine, maybe it's because, of your age and testosterone goes down. But when younger guys have low testosterone, the first thing we want to ask is why? And it's super common these days for younger men to have low testosterone, but why? So sometimes it's from chronic stress, because when you're chronically stressed, cortisol goes up, your stress hormone, and all that stress hormone shuts down testosterone. So if we can calm down the stress hormone, then we can let cortisol naturally get better. So that's one. Guys who have diabetes shuts down testosterone. So if we can do a better job managing their blood sugar, that can help. And the flip side is true too. If we can restore testosterone, makes their blood sugar better. Another really common cause is insomnia. So whether they like sleep apnea, they're supposed to be wearing that CPAP that, not a lot of people love to wear that, but sleep apnea or any kind of insomnia, you make testosterone at night while you're in a deep sleep. And so if you're not getting a deep sleep, then you're not making testosterone as well. So we got to get you sleeping.
Okay.
And then one of the biggest causes of low testosterone in younger men is toxins in the environment. So we got all these chemicals, right? Plastics and pesticide residues in our food, and there's stuff in the air we breathe. We're just exposed to so many chemicals all the time. And a lot of those chemicals are hormone disruptors. And that means they mess up how our hormones work. And for guys specifically, that means that they tend to get low testosterone and higher estrogen. And if you're a guy and you got lower testosterone and higher estrogen, first of all, you don't feel great. So it can make you feel more tired and kind of depressed or anxious and
cranky and acting like
yes.
That's okay.
And it can interfere with erectile function. And so sometimes helping minimize exposure to toxins, but also helping us flush those toxins out of the system is something that can make a difference. But of course, if you go to your regular doctor and your testosterone is low, you just get that prescription for the gel or whatever it is without even contemplating, could any of these underlying factors be fixed?
Right.
And one more thing I want to say, because they're not going to hear this from your regular doctor, but testosterone gets converted into estrogen in men and in women. Testosterone that's how we make estrogen. So for some guys, that happens too much. So their body takes their testosterone, keeps flipping it all over into estrogen. And if that's the case, if that's the problem in the first place, you could have you're making testosterone, it's just getting flipped over into too much estrogen. Now we give you some testosterone gel, and you're just going to flip that into more estrogen. So now your estrogen keeps going up, up, up. And you're expecting you're going to feel better because you're putting this testosterone gel on, but it's not really making much of a difference because it's just resulting in more estrogen. But the regular doctors aren't checking for estrogen levels. And so that's a really big issue. So any guy on testosterone needs to have their estrogen level checked, either, preferably before they start on testosterone, because maybe that's the problem. Maybe if we just block the estrogen, the testosterone would go up naturally. But especially if they're on testosterone, especially if they're on the gel, because you rub it on your skin, but the fat cells under your skin, that's where all that estrogen production is happening.
Okay.
And so it's really important to be monitoring estrogen.
Wow.
Wow.
She said a mouthful, guys.
Big one.
This is like the biggest Band-Aid scenario I've seen. I hate seeing young guys having to take the Viagra because I know, like you said, you know, they come in and getting their cholesterol or the diabetic medications along with the Viagra. And you know, if the doctor just trained the patient to take care of the underlying problem, you know, get them to, you know, kind of almost dangle the carrot like you need to eat better. We see certain results and then we're going to go this route or whatever. But at the end of the day, a lot of times there's major drug interactions. And a lot of times the doctor is like, okay, well, the patient knows not to take the Viagra with, like, let's say a heart, you know, a certain nitrostat or something like that. But how many times, if, you know, you're going to really think about not mixing the two, or, you know, like you should, you know, a lot of times.
Yeah, you taking meds. When you taking meds, you're like, oh, well, shit, I'm going to take them all right now because otherwise I'm going to forget.
Right. Or if you finally get a chick to pay you some attention, you're not going to be like, oh, I just took my nitrostat, my chest was hurting. Oh, I got this back. You know what I'm saying? You know, you know, but if you can handle it holistically, you know, that's like amazing. That's pretty great. I didn't think you can handle that with men. I know with women, we're more complicated, but there are ways to handle us holistically. But I never thought about men. So that was really, really good. You see, Blind got his wife, they're alive. My only question is, Kay, if Kay does climax classes, I'm asking for a friend. By the way, Gail Lockett wants to know. How's she gonna put Gail Lockett out there like that?
Just throw all of them. That's the friend, right? Okay. Well, as I stated in the chat, I do teach women bodies how to find their G spots. I answer all kinds of questions about masturbation and just knowing their erogenous zones and helping them out to do. In the course of all of that, women do learn how to achieve orgasm easier and harder. Easy and hard at the same time. So the answer to that question, I guess, yes, answer to that question.
Okay. I can't remember the question because you were breaking up so much and it was messing with my ADD. Oh, do you have something for that holistically?
I'm sorry. Your ADD?
There are. Using food as medicine and cleaning up your gut, the bacteria that live in the gut that make the chemicals that affect your brain, and making sure you're eating the right foods for you.
Okay, yeah. That chili was good, but I'm sick now. We say alcohol isn't the answer, but for some men, they think that it is. Not informed enough. You know what? A lot of men, you know, because with women, it kind of does get us a little loosened up. And so for men, they probably think it's the same thing. It makes them, like you said, make them feel better and probably more emboldened and stuff like that. But at the end of the day, alcohol will dry you up, even with women. All that sugars and stuff like that isn't good. And so let me see. Also, if a man has high blood pressure, medications. Oh, that's a good point, Patrice.
Yep. And depression medicines too, antidepressants. And, you know, low testosterone can cause men to feel depressed. So then they get on an antidepressant and then they don't get good erections anymore. Well, how depressing is that, right?
Right.
But if they treated the root cause in the first place, which was the low testosterone, then all of that could have been avoided.
Right.
And medications can also have adverse effects on women and their libido as well.
Absolutely. Especially those antidepressants. Those are among the worst.
Yeah.
Not all antidepressants, but some.
Yeah, there are some.
It's like it's a double-edged sword. It's like, okay, wait a minute. I'm taking an antidepressant and now I don't want to have sex. which is like a natural antidepressant in itself. I can't even have sex with it. I don't want to have sex with it. I don't know.
It really does do that. I mean, you have somewhat of a better mood, but it kind of gives like an overall aesthetic feeling, like a numbing feeling, like, you know, just everything is great, you know, it's like whatever, you know, you just don't have feelings for anything. Everything is whatever, you know. So Let me see. Y'all have any questions before we let Dr. Matthew go back to her vacation? She was so kind. She is in paradise right now, but
Interrupt
she can't.
Cabo for us. Oh my God. You gave up Cabo for an hour for us? That's beautiful.
Yeah,
I don't
she's
know if I
always.
could be that generous.
He said, "Did I miss women menopause conversation?" Not really. So how holistic? And we'll go ahead and we'll close this out because men, y'all ain't gonna do it, so whatever. But there are options holistically for men, and I've seen it a lot where there's so many drug interactions, and it's really not needed. That Viagra stuff, even for the older men, is really there are other ways to get a long lasting, more meaningful solution. It really is. And I just hate, that's one of our top sellers. And they're almost like $20 a pill. So not all, and you only get 6 pills at a time a lot of times. So, handle the business and the foundation and then build up from there if you feel like you have to. But a lot of times just doing things naturally, that's what our body wants. When you do things naturally, it kind of just naturally just meshes with our own body system and it runs so much smoothly. Whereas medications, you got to do the side effects, you got to do the tinkering around this medication, that medication. This is not worth it. It's really not. Thank you, Vaughn, Mr. Vaughn. Let me see. I will be talking about that on Friday. Also, my Vivid Life said don't go too much into that. This was really great, Dr. Deb, and you've been amazing. Thank you. I switched to a whole food lifestyle for health reasons, and your info is reassuring.
That's great.
They're really into it. So, okay, so we'll end off with the menopause. How can we're not there yet, thank God, but any day now. But how do you handle menopause holistically?
Yeah. So, not everybody who goes through menopause has a whole lot of problems. Some women just slide on right through and they're fine. They tend to be the ones that have like the underlying healthy body. But there's a lot of us where sliding through menopause is a bit of a hassle and we don't feel that good. And when our hormones go down, our brain doesn't work as well. It affects our mood, our memory, our metabolism, right? We start gaining weight. It's harder to maintain our shape. Interest in sex goes down. We get dry. So having healthy lifestyle habits is the most important part. So managing stress in a healthy way, avoiding toxins, eating healthy foods, being physically active, all of those things are really, really important. But for a lot of women, using the natural bioidentical hormones can make a really big difference. So bioidentical hormones means they're exactly the same thing that your ovaries used to make, not the drugs, because we used to give women hormone replacement therapy that was drugs, and then we found out they had some side effects. Okay. So not everybody needs hormone replacement therapy. A lot of women feel so much better when they do, but it's something that you have to talk to your doctor about and figure out if it's the best thing for you. And one of the things that I want to say is for women, we need testosterone too, just like men do. We just need a little bit though. Men need much more than we do. And that's not something that doctors usually give to women. But testosterone is what keeps us interested in sex. It helps us become aroused and have an orgasm. It keeps, all of our intimate parts juicy and lubricated and interested and sensitive. And so after we go through menopause, if those things, if when our hormones go down after menopause, sometimes sex is just not the same anymore. And testosterone can be really, really important in order to maintain and so that we can enjoy sex for the rest of our lives.
Right. Mm-hmm. So we don't have to suffer because we get older. We don't have to suffer. And the main thing is what we ingest into our bodies. Like right now, I cannot stop talking about this chili that is inflammatory in my body right now. I am on fire right now.
You said it was from Wendy's, right?
No, I got it from Showmars. It was good. It has the corn in it and stuff. It's like a little sweetness to it. But woo, girl, if I'm a dragon, I can just blow out some fire right now. I am on fire right now. And it's not even heartburn. Yeah, like my whole, anyway, that's besides the point. But we can control, I know I'm about to just be whiny, but we can control medicine. I remember when Justin Bieber said that he could control his depression from food. And he said that food is medicine, and the whole medical community just lit him up, and he had to make a statement. Oh, well, I didn't mean it like that. I should have been more responsible, blah, 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 blah. But that is God's natural food. Natural medicine for us. but we're the ones because of convenience, because of, society and, women out working, blah, blah, blah. You said what now?
Big pharma.
Big pharma. Yeah. Like everything has moved to, away from natural goodness to, the medicinal, synthetic, man-made stuff. And that is destroying, making our quality of life much less. So how can they reach you in this case? Because you said there are ways that you can do things online. It just depends on, because you're in North Carolina.
Yeah, I'm in Charlotte. So I got a few things.
Mhm.
One is for anybody who wants to come to Charlotte, our website is signaturewellness.org. So signaturewellness.org, and there's lots of info on the website about all how we can help people. If you're a woman and you kind of want to understand if how you're feeling could have something to do with your hormones, I wrote a book to help women understand, and you can get it on Amazon, but you can download, the book, first of all, the book is called This Is Not Normal, A Busy Woman's Guide to Symptoms of Hormone Imbalances, but you can get a free copy at isityourhormones.com. So you can download a free copy at isityourhormones.com. On our website, there's a link if you want to buy the actual,
Give it to me again. Is it your hormones?
isityourhormones.com.
Okay.
And then for the guys, so see, I started mostly treating, is it your hormones?
I know. I was like, okay.
Right. But so I started treating women mostly, first of all. And as the women were feeling better and better, they started coming in and saying, Dr. Deb, can you treat men too? Like my husband, he could use a little help here too. He needs to get healthy. So I ended up writing a book for men too. So the book that I wrote for men is called Why Can't I Keep Up Anymore? And it's a guide to restoring focus, energy, and physical and sexual performance for men over 40. And that one is available on Amazon, or there's a link on our website, but it's called Why Can't I Keep Up Anymore?
Okay, that's a good one. So how many men really read books on stuff like that?
Yeah, I don't know, but we tried to specifically think about guys.
Right.
We put a checklist, right? Like there's just a little, you don't have to read all the pages of information. You can look at the checklist at the end of the chapter to kind of go, yeah, okay.
Okay, so more likely women, we're the ones that will read the book, and then we will prod our men, or to why don't you do this, honey? And y'all, we women, we have a lot going on, but if our other half is suffering or not doing well, what is it one more thing to do for a short period of time? Just stay behind your husband, stay behind the person that you love. Even if it's like her dad or something, and if your mom, just done with her, or she happy, just try to, feed information. That's the best thing you can do is feed information. But like I said, like the people, that watch, they love holistic care. I mean, everyone is just, finally tired. We know there's a different way, and I've really seen a shift from the first time you done an interview with me to now. Like maybe it's a different crowd or whatnot, but people are tired, especially with the vid. People are tired of not being natural, so I appreciate you so much for taking your time out of a wonderful vacation to talk to us again. I hope in the chat that Gail Lockett, Patrice Garner said, this is a wealth of good natural information. Thanks to Deb. Yeah, so we are just really grateful because this was, we handled it from the rooter to the tutor. So that's yeah, okay. You have any last questions or anything? Or
No, Dr. Deb has been amazing, and I can't think of anything else to ask at this point. She's answered everything.
Right. Any last words, Dr. Deb?
I love what you're doing, and I really believe that living well is the best medicine.
There you go. Well, that being said, y'all take care and have a good evening. Take care.
Thank you.